Hey, Jim Hoffman here for EMS Office Hours, and this is your Monday Minutes. Today I want to go over a little bit some tips on getting IV access, okay? And, all of us in the field, we have our own sort of methods on getting access to IVs and tips that you might use, or something that your instructor might have told you, or maybe your training officer might have told you. So we all have our own sort of methods in doing it. So this is just some key things that I kind of picked out that I thought would help you when you're trying to get an IV, and it might not be as easy or as evident as you might have hoped when you're looking at the patient and what access you might have. Of course, practice and even more practice is key. And as you become a paramedic and you continue practicing as a paramedic, you'll find that you get more skilled at getting IVs, and even those difficult IVs that you have problems with, you'll find them more easier, or you'll know where to look, how to find them, and what works for you on those types of patients. So let's get right into it here. And I want to talk firstly about the vein itself. You need to ask yourself, can you see the vein? If you can't see the vein, try doing something like trusting your fingers more than you do your eyes when you're trying to find that vein. Sometimes you can't see the vein, but if you palpate the vein, or palpate the area where you think the vein should be according to, let's say, anatomy, you might actually be able to feel that vein more than actually see it. Okay. Now, another thing you want to try to do is if you do feel something, what is it you're feeling? You got to be careful that you're not feeling a tendon. Okay. Sometimes a tendon might seem like the vein that you're hoping for, right? So one thing you can do is to try to palpate that area through a range of motion to prove that it's not, okay, a tendon. Okay, and that's one way you can go ahead and do that and rule that out, that the patient, that area you're palpating is indeed a vein and not a tendon. Okay, it would be pretty evident to you when you're doing something like that. You're using a range of motion to sort of find out if it's a vein or a tendon. So, feel it with your fingers, but if you have that question, you don't want to try to stick an IV where there's a tendon. You want to make sure there's a vein. So go ahead and do that. And it can be tricky, but again, we go back to the practice comment that I just made. And again, the more you practice, the more you're going to be able to realize and figure out what indeed is a vein versus a tendon. Now, one thing that we have to talk about too is the advancement of the catheter, and this can be one of those things that you find hard, right? You might get a good flashback on the stick, and then when you go to try to advance it, you get difficult. Okay, you have a difficult advancing. Things like mild obstructions or the vessel itself might be fragile. You might get frictional resistance. All these things can actually be overcome if you just sort of twirl the catheter hub just a little bit to try to give a little bit of a rotary motion, okay? And this way, as you're advancing the catheter, it's going to help glide over those sort of points of hang-up that you might be having, okay? Those mild obstructions, a fragile vein that you might be having, okay? Now, one thing to keep in mind, if you're going to do something like this, you're going to need a free hand. You can't just do it with one hand. You're going to need a free hand to do it. You need to be gentle, or you're going to need somebody to help you go ahead and do it. Now, other thing is, sometimes nowadays you get those safety cannulas nowadays. It's a little more difficult and a little more awkward than it used to be with those old style sort of IV catheters, but you still can do it. But again, you need that free hand, or you need an assistant to try to help you with that. But that's one way you can try to get over those obstructions. Now, finally, I just want to go over the target, right? Now, us in EMS, what happens? A lot of times we get a moving target, of course, right? Now, it can be the patient moving. A lot of us get those patients, and the patient keeps moving their arm. They're fidgeting. They're anticipating the stick, right? So they're moving their arm. Or you might get, of course, the motion from the ambulance itself. One thing you can try to do is to lock the patient's arm in an extension and try to block that flexion at the elbow. So it might be necessary for you to sort of tuck the distal part of the patient's arm under your own arm, right? And be able to control that limb motion. And it could be the motion from the ambulance or the patient, either way. But try to maintain that contact, okay, of of your hand on the patient's limb, okay? And what you can do is get aware of the rhythm. That's something that I find helps me the most when in the back of the moving ambulance. And I try to become aware of the rhythm of the ambulance, the rhythm of the motion that's going on, okay? And sort of try to time my venipuncture along with that rhythm, along with that motion. Okay, so that's something that I do personally. You might have your own sort of tricks that how you start IVs in the back of the ambulance as well. Now, guys, like I said, practice is the main thing that you need to do, and these are just some short tips that I think and hope will help you when you're doing your IV sticks and you have those sort of tricky situations going on. I'd love to hear some of the ideas and thoughts that you use when you're starting IVs and some tips and tricks that you use that go sort of beyond the basic textbook or beyond the basic skill. Let me know by posting it in the comments here below on YouTube or on the blog at emsofficehours.com. If you like these tips, I have a free report here over on the main site called Uncovering Difficult IVs, and this report goes over some of the stuff that I've just talked about, but a lot more, and it reviews, in addition, a lot of IV supplies and basic techniques, but I also got a lot of real-life tips from other experienced field paramedics that gave their sort of personal tips and tricks on starting intravenous access. So go ahead and here you click the graphic, a little click here, link here, and it'll take you over to the site, and you can download this free report. It's a free report. Just download it to your computer. It's a PDF file, and you'll see it's got a lot of the basic stuff, like I said, but I think to me, the gem of this report is getting those real-life tips and techniques from those experienced paramedics that are out there. All right, guys, that's it for me. I hope, again, you can use these Monday Minutes. If you have some minutes of your own, I'd love to hear them. I'd love to hear some suggestions for some Monday Minutes in the future. Send them over to me. The email address is contact@emsofficehours.com. And until next week, as always, Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.